Carmen here. I am back. Yay! I had so much fun in Nashville and I have so many pages of notes to share with you guys, but I got to sort through all of them. So first of all, let me introduce myself. If I am new to you, my name is Carmen. I have a myofunctional therapy business. I'm an educator. I do all the things. I help you guys understand myofunctional impairment. I teach dental hygienists how to become myofunctional therapists because there is so much need out there. So I do all the things. I'm here each week, and then I have a lot of information on my website where we'll talk about that in a minute. So I'm going to get all fancy dancy here today, and we are going to be talking about 3 important topics that you should be discussing with your spouse. And so really, when I was in Nashville, this just kept coming back to me thinking about, gosh, there's so many people, myself included, because most recently my sweetheart commented that he had long ago been diagnosed with mild sleep apnea. Of course, this was new to me, and I had been noticing that he was starting to sleep longer. He was starting to snore a lot. I was giving him the old elbow a lot of the times. And so I was thinking, gosh, I need to have a conversation with him to talk about this stuff. And so it really made me think about how many spouses out there just, overlook some of this stuff. So we're going to be talking about the 3 topics that I really think that we should be talking about. So the first one is going to be snoring. Many of you, me included, just think that this is something that's totally annoying. So whether that is mouth breathing, whether that is snoring, or in my case, or potentially your case, if that's untreated, diagnosed sleep apnea, this is more than just an annoyance, okay? This is a huge concern. So talking with your sweetie about this is so important, and there's going to be more pieces of the puzzle, and we're going to talk about that here in just a second, but stop just accepting that this is just normal. I know my ex-husband used to snore really bad, and I would just get up and go to the other room. So of course that was long before I had my myofunctional therapy training in my business, but looking back on it, we should have been sitting down and I should have been saying, oh my goodness, you are having so many concerns. You're gasping for air at night. You're not breathing, all of those things. So if you're that person who potentially sleeps in the other room, or maybe you are just putting up with it, maybe you go to bed before your honey, maybe you wear earplugs. If you're doing that, then there definitely needs to be a conversation for sure. Next, let's talk about the uncomfortable things. And so those uncomfortable things to be talking about are low energy, low motivation, potentially weight gain, and bedroom stress. So the reason I call these uncomfortable things to talk about is because this is your person. This is, your best friend, your love, everything. And to say, well, hey, honey, I noticed that you're not very motivated lately, or I noticed that you just have a lot of low energy. For me, with my sweetheart, I was just noticing, like I said, that he was sleeping longer and he just wasn't waking very refreshed. And this, over the last 4 years, was something that I had noticed to be different. So we definitely had that conversation about here's what I'm seeing. And of course, it was a lot easier because through the course of conversation, whatever it was that we were talking about, he said, oh yeah, I was, diagnosed with this previously. So of course, we have really leaned into that conversation. What are we going to do about it? What should you do? All of that stuff. Weight gain. So that's really hard when somebody has poor sleep, when somebody has sleep disordered breathing. I talk about this a lot in my Vital Healthy Person webinar, which you can, let me see, hopefully I don't mess things up here. So with this link, you can watch this webinar. I talk about I really dive deep into the fact that you cannot be a vital healthy person if you have myofunctional impairment. So I go into that. So that's something, one of those things is weight gain. And oftentimes that is just from what's going on in your body. You're not sleeping well. You're not energized. You're not motivated. You have chronically elevated stress hormones. You're choosing to put crap in your mouth. You're not eating right. So whatever it is, it all equals weight gain. And so that's difficult for spouses to talk with each other about when there's a concern there. So that's why I call it an uncomfortable thing. And then last is the bedroom stress. So, and this really is for the men in my audience, because many of my clients, men, they don't want to address their sleep disordered breathing until there is an erectile dysfunction problem, and so that's not the only thing that can cause it, but definitely that's a big red flag. So when I have male clients who finally get that connection, when they say, oh, I've had bedroom stress, whatever you want to call it, and then they get diagnosed with sleep apnea, then they start putting those pieces of the puzzle together. All right, let me move on to the next one. So cognitive decline. This was an area that just blew my mind when I was in Nashville. And like I said, I can't wait to wade through the information because there's so much I want to share with you. For me personally, this was a biggie because I have always been afraid of Alzheimer's disease, and I think some of it is we feel like our brain is not ever, I feel like this, and I'm, 45 years old. So I feel like we have a lot on our plate. We try and put a lot of stuff in here. So that makes a big difference for me. But because sometimes I feel forgetful, I always get concerned about, having cognitive issues. So when I was sitting in this seminar and I was learning about Alzheimer's disease or cognitive decline, and I learned that this is a lifestyle disease. So your diet and lifestyle can lower your risk. And that really was something that I came right home and wanted to talk to my sweetheart about, because it's something that we can have some control over, which has really made me feel a lot better, because I thought that it was just something that you were bound to get. So let's talk about lifestyle changes. So improved sleep. You guys hear me talk about sleep all the time, and I will be talking about more sleep coming up, because I learned a lot of stuff in Nashville about sleep studies and how different, how they look at them differently, different sleep tests. And if they use one standard, they may say you're fine. And if they looked at a different standard, then you could have severe apnea. So it was really eye-opening. But the bottom line is, if you don't get good sleep, then there's a concern. So making changes there is going to be helpful. Decreased inflammation. If there was something that was just this overarching message at this Collaboration Cures event, which brings doctors and dentists together so that they can work on the health system of a patient, rather than this silo mentality that it's like teeth, mouth, and then the person, because on the inside, there's no line. So inflammation was huge. And, obstructive sleep apnea is inflammatory. So many different things. Poor diet is inflammatory. So that leads to improved diet. And I'm not here to, push one way of eating versus another. But the ketogenic lifestyle was definitely very heavy in a lot of the research. So that was really interesting to me. So I definitely want to learn more about that. And then last, moving the body. So what do you do to get started? I get asked this a lot. So first, I want you to get a myofunctional evaluation first. And this is because we're going to really do an integrative health assessment. We're going to ask a lot of questions and look at a lot of things. We're going to address compensations and structure, function, and behavior, and help you build your care team and help deliver an organized plan. So we're really the person who can help get you going in the right direction. When I do an exam with somebody, if you can't nasal breathe, if you can't, you may not be doing it as a habit, but if you can't demonstrate that you have patent nasal passages, I'm going to be helping you, contact your an ENT, somebody to do a soft tissue evaluation. If you need ortho, if you need expansion, if you need a sleep study, all of that stuff, I'm going to help you figure out what you should be doing when and why. And so I really feel like we're kind of the hub of the wheel to help you. So if you do your myofunctional evaluation first, that's going to be the first step. The other thing I want to tell you is there's a lot of information out there. You can go to my website and you can click on blog, and it's going to give you obviously the most recent, and then sequentially it's going to go from there. There's so much information. So many of you will email me and ask questions, and I've covered it, and I can go back and just give you that link, which is really easy. So of course, if you have questions, or if there's something specifically you're wondering if I've covered, email me and I can give you usually not just one, but possibly 2 or 3 blogs that I've done on a topic so that you can evaluate it and figure out what to do. The next thing is the free assessment tool. So I talk about this every week. A lot of you like to do me search. So you want to figure out whether you have concerns or not before you even worry about talking to me, before you worry about having that myofunctional assessment. So you can go to the bottom of any blog, any of my most recent blogs. If you go back to last year's, you're not going to find it because I didn't have it then. But if you go to my recent ones, then you're going to find that at the bottom you can sign up to get that. When you sign up to get that, then you can also choose to go on my mailing list, which you don't have to do to get it. I recommend it because then you get all of my nurture emails, which I put one out once a week. Sometimes that's my new blog. Sometimes that's whatever it is that I'm talking about that week. So you can do that. Let me go back to this. So that free assessment tool, it has 25 of the most important questions that I'm going to ask you when I do your comprehensive exam. Everybody has to have a comprehensive exam so that we can put together that treatment plan for you, but you don't have to start there. It does not cost you anything to do that assessment and to get the assessment tool. So here, again, right on my website, you can schedule a comprehensive exam, which there is a cost for that, but right beside it, you can schedule a free 30-minute assessment. It doesn't cost you anything, and that visit with me is going to give you a chance to ask questions, meet me, see if so if you like me, eventually we'll build that relationship of trusting, all of that. But if you don't like the sound of my voice, obviously you're not going to want to do therapy with me, which is fine. I just want you to find somebody. But when we do that free assessment, I'm also going to make sure that it makes sense for you to move on. But if you have any of those things that I just talked about, then definitely you're going to have to move on to a comprehensive exam. So why is it important? There are long-term consequences, and so many of you say, myofunctional therapy is expensive. Seeing the ENT is expensive. Having airway or ortho expansion, all of those things are expensive. However, the long-term cost of the chronic diseases that are arising because of sleep disordered breathing, of inflammation, airway crisis, fragmented sleep, all of those things, they're expensive. And I think it's more important to fix your problems now rather than, down the road. I have a lot of clients that are 60, my oldest is 78, and those clients really wish that they had taken advantage of fixing the problem earlier, because now they have better function. They're not having swallowing issues, that kind of stuff, and they wish they had done it. So when you're comparing money, I don't even think it should be a point, because the long-term consequences and the long-term cost is going to be much greater. Not to mention there's a domino effect. So as things start to happen, then you can see it just kind of is like a snowball rolling downhill, and it does not go away. Next week, we're going to be talking about who to get on your team and why. So that is that. Let me go to This one, yay! Remember, we're small but mighty. I spend a ton of time and I put a lot of resources out there for you. If you know anybody who needs to hear this or any of my other videos that I have on YouTube, any of my blogs, can't think today. Also, I have the Tongue Tie and Myofunctional Therapy support group, which is a great place to ask questions. There's a mix of people. All providers, there's doctors, there's all sorts of stuff. So it's a great way to get information. So more than anything, I just want you to share this information. I'm going to be live every week for a long time because I'm not going out of town again for quite some time. I like being here. Remember, if you have a particular question, reach out to me and ask. I will see you next week. Bye for now.